Namaste, welcome to this special interaction with one of the activists and the former bureaucrats, Dr. Jaya Prakash Narayan garu. Sir, welcome. Thanks for joining us. Sir, first of all, you have been an activist and you have been someone who is raising awareness in the society. So what do you have to say about the affordability of healthcare services? At the same time, many private hospitals coming up, are they living up to the expectations?
Sudheer, we have a very vibrant private sector in healthcare and very underfunded public sector. You take the governments in India, both the union and the states together, they spend 1.2% of GDP, one of the lowest in the world.
Yeah.
Typically, rich countries spend 9 to 10%. Many other countries spend 4, 5, 6%. We are spending 1.2%. Naturally, the government's inability to function well is leading to enormous hardship. Every year, about more than 50 million people are descending into poverty on account of healthcare problems, either because they are unhealthy, they have no access to healthcare, they cannot work, their income is lost, or they had to borrow money, or they had to sell their assets to cover the healthcare costs because of catastrophic illness. At the same time, what is happening is because the middle class is rising, the people who can afford and who want good quality care, that number is rising, just like in healthcare, private education. India is attracting the largest investment in private sector healthcare in the world. Both education and healthcare were the biggest recipients, biggest destination of foreign direct investment. So high quality hospitals are coming. The good part of that is they are maintaining global standards of care. You know, if you remember, when Prime Minister Atal Bihari Vajpayee ji, he had knee replacement. He was the first one in India, in Bombay. We all thought, my God, knee replacement.
Yeah.
People came from Britain and other places. Now, in Hyderabad, every day probably you do 200 knee replacements. Similarly, heart surgery, when Akshina Nageswara, the great Telugu star, superstar, when he got a heart surgery done in America, there used to be stories about that. Today in Hyderabad alone, you do 200 cardiac bypass, coronary bypasses. So we are able to give that access of care to people at the lowest cost in the world with world-class standards. So we have the good and the bad, both simultaneous.
Yeah.
What we need to do is, A, the government must step up, improve the quality of primary care, but not merely expanding government hospitals. Unless you actually create a private sector kind of atmosphere in public systems. That means I can go to any one of the 10 doctors that I like. I don't have to pay out of the pocket. I can choose. So unless there is competition and choice, it will not improve in public sector. We must leverage the private sector strengths. Already Arogyasri, Ayushman Bharat, they are utilizing the private sector. We must attract the patients from all over the world because we can provide world-class care at a low cost. So healthcare needs enormous improvement. Luckily, the good news is a bit of expenditure, not much. The government at the national and states level, they spend another 0.3 or 0.4 or 0.5% of GDP, which still is very, very low. We can dramatically improve healthcare. And because we have systems in place, we have quality personnel in place, we have technology in place, we have high quality skills in place, we can improve it. But we must make healthcare and education the centerpiece of politics. Unfortunately, they are not the central issues of politics.
Sir, generally ailments like cancer and other things usually hits the entire family economically, even the sell of their assets and properties. Still, though Ayushman Bharat is mentioned and in Telangana and Andhra Pradesh there is something called Arogyasri, but still it is not able to cope up with that. Where do we stand? And usually when we talk with the private hospitals and doctors, experts, they say affordability and quality healthcare services do not go hand in hand unless and until there is a huge support from the government. And at the same time, they also say healthcare budget is always low compared to others. There is something called universal coverage. Where are we standing and how much would it take for us to get that universal coverage?
No, you are right, Sudhir. That's why I mentioned to you, the total expenditure by the governments in India on healthcare, but the union and the states is only 1.2% GDP. To have reasonable care, you require probably minimum of 3 to 4%. India cannot afford that, unfortunately. There are so many other budgetary priorities and we don't have enough money to spend. But what I'm urging therefore is a quality primary system. You mentioned cancer. See, earlier, 50 years ago when I did medicine, most of the problems are infectious diseases. You required proper diagnosis and antibiotics, that's all. Maybe vaccination. Whereas today, with average lifespan increasing in India, also we're living for 70, 75 years on an average. The lifespan increasing, 4 diseases are now dominating. Cancers, heart disease, including blood vessels, for instance, hypertension, BP, etc. Diabetes and kidney problems, the third major problem. Then trauma, because the road accidents, etc. A lot of trauma and orthopedic care problems. These are the four big things. Even in Arogyasri, you go to Telangana or Andhra Pradesh, you will see 50% of the money is spent on those things. So what it means is, these are all, there's no single cure, one-day cure. Screening, if you diagnose early, if you catch them early, supposing you have, let's say, like polyps of colon. If you detect early, you can prevent the colon cancer. Supposing you regularly do screening for heart disease, before the problem becomes serious, you are able to address it. Diabetes, you diagnose early, proper management of diet, exercise, and medication if necessary. Because we are not able to do that, things are becoming catastrophic. An easy problem becomes complicated, potentially deadly, then you have high-cost care necessary, tertiary care. So if we are smart as a country, we must invest in high-quality primary care, but not through government bureaucracy. People don't have faith in government bureaucracy. People don't want to go to government facilities. Yes. So create like a private sector atmosphere. Arogyasri you mentioned. What is the success of Arogyasri? You can go to any hospital of your choice, private or government. There is competition among the doctors or the hospitals. Automatically things improve. Some such similar thing you could bring in and improve tertiary care in government hospitals. There's no time to go into details, but at a very low cost, about 0.5% GDP, we can dramatically improve healthcare outcomes by integrating public sector and private sector, public-private partnership, intelligently applying our knowledge and skills, and utilizing our strengths in the system. Unfortunately, as I said before, healthcare improvements is not a central political issue. We are spending all time, I give you free power, I give you free water, I give you free something else. Whereas the true things that eliminate poverty are quality education and skills and quality healthcare. Everything else is very, very secondary. Unless we go back to these two central issues, quality school education to every child without expenditure, quality healthcare to every person without out-of-pocket expenditure. Unless we go back to these two things, India will not be able to fulfill her potential.
Thank you, sir. One last question. Sir, Pradhanamga, preventive measures are considered to be the way where a person can control his health and the economic conditions around the health. మీ మెసేజ్ ఏముంటుంది సార్ జనరల్ ప్రజలకు?
సతీర్ నేను అన్నట్టుగా ఒకప్పుడు ఇన్ఫెక్షన్ డిసీజ్ బాగా ఉండే అంటువ్యాధులు ఉండేవి. దానికి అయితే టీకాలు, లేదా పరిశుభ్రత, మంచినీళ్ళు వగైరా. అలాగే ఇప్పుడు మనకు ఉన్న కొద్దికి నాన్ కమ్యూనికబుల్ డిసీజెస్ అంటే అంటువ్యాధులు కాకుండా దీర్ఘకాల వ్యాధులు వృద్ధాప్యంతో వచ్చేవి. డయాబెటీస్ కానీ, బ్లడ్ ప్రెషర్ పెరగడం కానీ, ఒండె జబ్బులు కానీ, లేకపోతే కిడ్నీ జబ్బులు కానీ, ఇలాంటివన్నీ కూడా. వీటికి టీకాలు ఉండవు. కానీ సకాలంలో కానీ డయాగ్నోస్ చేస్తే ముందుగానే మేల్కుంటే, ఉదాహరణకి డయాబెటీస్ బాగా ముదిరిపోయి, శరీరం అంతా కుళ్ళిపోయి, కిడ్నీస్ అన్ని దెబ్బతినిపోయి, మరి రక్తనాళాలు దెబ్బతినిపోయిన తర్వాత మనం మాట్లాడితే ఉపయోగం లేదు. ముందుగానే డయాగ్నోస్ చేసామనుకోండి, కొద్దిపాటి జాగ్రత్తలతో ఆహారము, కాస్త వ్యాయామము, అవసరమైతే మందులు వాడితే అసలు ఆ ప్రమాదం లేకుండా. కాబట్టి వ్యాధులు మారుతున్నాయి వయసు పెరిగిన కొద్దీ, అంటువ్యాధులు కాదు. కాబట్టి ఇక్కడ వ్యాధి నివారణ అని చెప్పంటే మనం ముందుగా డిటెక్ట్ చేయడం, జీవనశైలిలో మార్పులు అవసరాన్ని బట్టి తీసుకురావటము, చిన్న దశలోనే దానికి వ్యాధికి చికిత్స చేయడం, దీర్ఘకాలం మేనేజ్ చేయడం, ఆ ప్రయత్నం చేయాలి. అది చేయకపోయినట్టయితే ఖర్చులు పెరిగితే ఫలితం తక్కువ.
Thank you very much, sir. That is Dr. Jaya Prakash Narayan garu, who is stressing on early regular screening and preventive measures and lifestyle changes. Thank you very much.